Good afternoon, Dialysis Patients Citizens Education Program. I am Dr. Velma Scantlebury, and I am here to talk to you this afternoon about anything you would like to talk about. Sorry about that. I am still at work, so I apologize, but I'm here with you today, so let me know what you would like to talk about. As I say, we are here in Delaware, and it is still pretty sunny, and the weather is improving. We're not quite in spring yet, but it is 55 degrees, and I'm grateful for that. So for those of you who are joining or have joined, I am Dr. Velma Scantlebury, the medical consultant, and I'm here to answer any questions that you would like to discuss, touch on. I may not be able to answer everything, but I'm hoping that we can at least have a discussion and you can let me know what's on your mind and what you want to talk about today. So this is an open forum, so I'd like to dive in and find out who's there, who has joined. Let me know where you are from and whether or not you are on dialysis or have had a kidney transplant, or you are just a caretaker, because it's also very important for us to recognize that caretakers are important, or ambassadors are important. All of us involved in this fight to advance transplantation, to advance technology where it comes to improving dialysis access, improving dialysis education, knowing what your choices are, and also understanding the risks and benefits of going through a transplant process. So thank you, Nancy, for joining, and we'll wait for others to come on, and hopefully those of you who are here, if you have any questions and would like to have a discussion around any topics that I can answer or that I can enlighten you on, please do so. Again, I'm Dr. Velma Scantlebury, and this is your Facebook Live, and it's the fourth Tuesday of the month, and I'm looking forward to having this conversation with you. So let me know what your discussion is. Remember, this is March, which is Kidney Month, and it is also Women's History Month. And so it's important for us to recognize that, while there are so many people on dialysis and so many people diagnosed with end-stage kidney disease, there are even many more who are not aware of their diagnosis of kidney disease. Chronic kidney disease is a silent disease. Folks may go to their physician, they may get their lab work done and told, oh, well, you have a little bit of kidney disease or kidney insufficiency, but you need to know your stage, and you need to know what are your expected outcomes when you have stage 2 or 3 or 4. And so those are things that asking your doctor more questions as to how can you improve or how can you prevent decline of your kidney disease becomes important. Nancy's asking the question, do you lose muscle mass on dialysis, and if so, why? Well, first of all, many patients, one of the things we struggle with patients on dialysis is keeping up with their protein intake, and protein is important to maintain muscle mass, but it's a struggle for many people, even those who are not on dialysis. I pay many of my patients, as we get older, we say you need to improve your protein intake so that you can strengthen your muscles and not lose muscle mass, because if you don't take enough protein in, you may feel that you're losing weight, but you may be losing muscle mass. So you need to have that significant amount of protein based on your weight, based on your kilogram weight, so you can while you want to lose fat, you want to be able to build up your muscles. So that becomes important. And getting that intake can be hard with all the limitations that you may face being on dialysis. And the other thing too is we strengthen our muscles, and we build muscles by doing strengthening exercises, so that we can, whether it's just a little bit of weightlifting or a resistance band training, so we're working those muscles. So unfortunately, it's hard to keep it with all the things you need to be doing while you're on dialysis, and that's tough. So even if you're just using your legs while you're sitting down with some resistant bands, pulling your muscles, having your muscles work actively, it becomes important. But it's also important to make sure that while you're on dialysis, you are working with your nutritionist to increase and to maintain your protein levels so that they're not constantly dropping. Thank you for the question. Again, for those who have joined, my name is Dr. Velma Scantlebury, and I am the medical consultant here at DPC Education Center, and we would like to have a discussion with any questions you may have. I was pointing out that March is Kidney Month as well as Women's History Month. And just a little fun fact, you know that the first female kidney transplant surgeon was Dr. Jonah Ogelson. And she performed the first kidney transplant back in the 60s, and really went on to be a chairman of the surgery department, and was the really breaking ground for women in transplantation long before many others came along. So we're grateful for all of the contributions that she has made to make it possible for other women to enter the field of transplantation. And we're also grateful for all of those who have contributed to success of dialysis and improved all the nephrologists that are out there that are able to improve the initiatives when it comes to getting patients the best dialysis possible, whether it's hemodialysis, whether it's home dialysis, or whether it's peritoneal dialysis. So Nancy asked a question, do some people crash into dialysis? If so, what are the reasons, some of the reasons? If I'm understanding you right, when you talk about people crash into dialysis, I guess I'm thinking more in terms of acute dialysis, in the times that maybe where you don't know that you unaware of your end-stage kidney disease, and you're feeling bad, you're retaining fluids, you just feel like something is not right, you're tired, your hands are shaking, and you then show up at the hospital because something is wrong, do your blood work, find that you're in end-stage renal disease, and suddenly you need to start hemodialysis, because that is the therapy of treatment for acute kidney failure, or even if it's acute and chronic kidney failure where your clearance is less than 10, and therefore it becomes important to institute immediate dialysis. And so anything that will cause you to need acute dialysis would be acute fluid overload. You're not aware, or whether you're aware, but your heart can't take the extra 5 to 8 pounds that you gain in fluid. For some people, it may be even less. And suddenly you are in congestive heart failure because your heart cannot pump that extra fluid around, because your kidneys cannot get rid of it. So now where are you? You're stuck with where your heart pumpability is so decreased that the only way to get that extra fluid off is to acutely dialyze you and take off that fluid without jeopardizing, or to minimize the effects on your heart because of the acute fluid that has occurred by whatever reason, whether your salt intake was high, your blood pressure was high, your potassium is high. Sometimes you will need acute urgent dialysis because of hyperkalemia. and you're unable to get rid of that potassium via your urine. One of the things that our kidneys do is when they're functioning, they can give you diuretics, we can give you other agents such as mannitol to help you get rid of that potassium via your urine. But if your kidneys aren't working well, there's a minimal effect of a diuretic in helping you bring your potassium down. So acutely getting rid of potassium can occur either via the GI tract, where you're given some agents that cause you to have diarrhea, that you may be able to get it out that way, but for most people it's going to require an acute dialysis. So you don't want to, especially over the holidays or when you're on vacation, or if you're traveling and get stuck someplace where you're unable to get dialyzed, then you may end up in needing an urgent dialysis treatment. One, because you've missed your treatment, your fluid volume is too high, and your potassium is too high because of some illness, and those things can also, different things can happen to cause you to say, okay, this is going to be an urgent need. Sudden illness which involves drugs could cause renal failure, cardiac failure, and diabetes. That is true, because one of the things that we want to be careful about is that anything that you may be taking can cause, say for instance, some antibiotics may not be good for your kidneys and can cause acute kidney failure, and that becomes critical of knowing what to avoid if you have renal insufficiency, or even stage 3 or mild stage 4. Certain medications can tip you over and cause you to end up with stage 5 or kidney failure that's going to not be reversible. In some cases, it can be acute kidney failure, which means it's a period of time, but there's recovery that can occur. And certainly heart failure and diabetes can be a result of certain medications as well. Thank you for that. Is protein powder a good source for supplementing your diet? And if so, what type? It all depends on what's in the protein powder, and not all protein powders are equivalent. So you want to make sure that you are paying attention to the ingredients, whether you want to make sure if it's plant-based. Some protein powders, if you're in dialysis, may have chocolate or cocoa in them that may not be compatible with your restrictions or need for restrictions. So labeling, reading the labels, making sure that sometimes some supplements, in terms of protein supplements, may be also high in potassium. So you've got to be diligent about reading the labels, making sure how much sodium is in them, how much potassium is in them, and other items that may be detriment to your health, as well as the sugar substitute. So those are things that you have to look at, and how many grams of protein per scoop, and also how many calories per scoop if they're coming with calories. So you do have to, oftentimes the safest thing for protein supplements, if you're on dialysis, is going to be those that, and especially if you have diabetes, you want to be able to make sure that they're low in potassium and they're low in sugar from that type. So it's really about, there's so many that are out there on the market that you have to be careful whether you want plant-based, whether you want whey protein based. So read the labels. That would be my suggestion, and talk to your nutritionist at your unit to see whether it's compatible. Volume is also important. So when you think about protein powder supplements, the question is how much volume is required to mix that powder in order to let it be beneficial. So the smaller the packet, or they can be a concentrated protein powder, or it may be even a collagen protein powder, which you can mix in a small amount of fluid as opposed to the thicker one. So you want to be able to look at what volume is needed, because you want to be careful about your volume content, especially if you're on a volume restriction. Is it fact or fiction that some loss of kidney because some lose a kidney because they claim they cannot take the volume of medicine every day? Not really. I would have to say, when you're on dialysis, you take a lot of medications. And you're switching out different medications to to a whole new set post-transplant. The ability to get off dialysis and be able to urinate is a very small trade-off for some medications. Most of the medications that you're taking post-transplant within the first 3 to 6 months can be a lot because you're taking your immunosuppression, but there's also some preventative medicines that will go away in 3 to 6 months, whether it's antivirus, whether it's antibacterial medicine, whether it's medicine to keep the steroids or the medication from giving you ulcers. Those will usually go away over time. But remember, the medicines that you're going to take that you were taking prior to, if you're taking medicine for your high blood pressure, you may still need to take that. If you were diabetic, you may not be taking a lot of medicine on dialysis, but then after dialysis, your diabetes raises its head again, and you need to control that. But if you are on medications for your lipids and your heart, all those medications will continue. So replacing the kidney doesn't eliminate your underlying other diseases. So the one thing for some patients, your blood pressure may get better. That's for some patients, depending on how many medications you're taking in. As far as loss of kidney, I can only think of one patient who was anorexic and was concerned about all the water she had to drink and the prednisone causing her to gain weight after transplant. We thought she had been cleared by her psychiatrist for clearance for kidney transplant, and that she was over that phase of needing to be thin. And I have to say that she lost her kidney because she refused to take her medications because she was concerned about gaining weight, and that she was so much fatter with her kidney, her whole 100 pounds. But I would have to say that it's very unusual and it's a minor trade-off for being able to say, okay, now I have to take 10 medications versus my 5 pre-transplant, because you're on phosphorus medication, you're on medications for your parathyroid, you're on it for your blood pressure, and so there may be a whole host of different medications that may go away. But now, for instance, we're giving you medicine to keep your phosphorus low while you're on dialysis, and then after transplant, now we're forcing you to eat things to bring your phosphorus up. So it's a little bit a give and take when it comes to that. There are 2 sources of protein that are in powder: milk protein and pea protein. Don't forget that too much protein can be harmful to kidneys that are compromised, that's in the pre-dialysis state. And so you want to be able to get your protein, but you also want to listen to your caretakers and your health providers, as well as your nutritionists. Thank you. Let's see, Patient Citizen, March live with Dr. Scantlebury. Thank you so much for joining us today. Thank you. Making sure I'm not missing. I lost calcium, bone, on dialysis and with my transplant, and that's unfortunately when you have when you're on dialysis and you have that issue with calcium metabolism, calcium phosphorus back and forth. Calcium comes out your bones. You're more likely to have thinner bones the longer you are on dialysis, and more bone loss. And so after transplant, we make sure that we try to supplement with different calcium supplements, make sure your vitamin D is up to normal. And so those are things that we struggle with. Certainly the longer you are on dialysis, the more, or if you have been on steroids, you're going to have more bone loss from that standpoint. So thank you all for joining, and thank you for the patient ambassadors. Again, for those of you who are new here, I'm Dr. Velma Scantlebury, the Medical Director for DPC Education Center, and we're here having a discussion. I thank you all for joining. right after my transplant, I asked my doctors question about my fistula. Would it be closed off, etc.? Generally not, because oftentimes if you have a fistula or a graft, we try not to close those off unless it becomes a problem. Some patients may have a smooth course, but remember, transplants don't last forever. Patients may need that access for different things that may come up, even though the kidney function is normal. Some patients may have rejection. They may need high-dose therapy. They may need various things that we can still, with the advice of the nephrologist, use their fistula. If there's any acute processes, and that fistula can stay there unless there's issues with aneurysmal formation, an infection. The goal is to keep it there, because you never know what may come down. Some patients, when years later, when the kidney fail, is still functioning, they're able to still use it. So we try not to close it off unless there's a certain time and we know that you've been now many years out and it's now becoming an issue. It can often be a steal to your heart, where your heart is now having the effect of this high volume flowing back into your heart. So all those things are taken into consideration when we think about, is there a need to close off or tie off this fistula? Thank you for that question. Hello, everyone. Thank you for being here. Thank you for all the members of the patient ambassadors. One patient, Ms. Williams, is stating, Azir Mara, I take medications just to bring my potassium levels up, my phosphorus levels up. And for many patients post-transplant, that is a big problem, because now your kidneys are working and you're working so well that you're depleting all your phosphorus, and phosphorus can be low. And now we're asking you to eat foods that are high in phosphorus. Let's see. Hope I'm not missing any questions. As I always enjoy, happy National Kidney Month, Women's Month, Colon Month. Thank you. Thank you, Lisa. Every month, there's always something to highlight. And for those, when you talk about Colon Month, make sure that you get your colonoscopy and make sure that you're up to date with all your cancer screens, because that's important as we become not only transplant patients, but also prior to transplant. While you're on dialysis, you want to still stay healthy, because you want to, yes, you are prolonging your life, but you also don't want to be subjected to something that's going to cut your life short while you're trying to advance to possible other options, such as even getting on the transplant list. Yolanda is encouraging those of you who have not joined DPC, you to go ahead and make sure you become a member, because there's so much to offer. And we have, as she would highlight, that there are patient ambassadors. There's so many patients on dialysis, and there's a lot of work that can be done and is being done to improve the lives of patients on dialysis, to really advance issues when it comes to dialysis and transplantations, even when it comes to promoting or being able to have people who are wanting to be donors but can't take off time, being able to have that Family Leave Act, advocating for those who may not be able to go back to work, those kind of things. So there's a lot of work within the legislative world that requires advocacy, and so if you have the time, the energy, would be immensely grateful to you becoming part of DPC, becoming a patient ambassador, and letting your voice be heard as for others, and we can be upfront for those who can't be there. So thank you for that. Nancy has another question. I don't see heart failure and transplant. How do you handle the extra fluids? And it's important to know that Heart failure is in direct relationship to your time on hemodialysis, especially in-center dialysis, where there's less control of your volumes and your ability to dialyze them. The advantage of home dialysis is that you have the ability to dialyze yourself 5 days a week or 6 days a week so that you can control your fluid status and keep it under par. If you're gaining fluid and 2-3 days before you return to dialysis, then your heart is now handling 5, 6, 7 kilograms of extra fluid before you are dialyzed again. And think of that as you think of a balloon that you blow it up and you have this fluid in the balloon, and the longer you maintain that extra fluid, that extra weight in that balloon, and finally you let it out, now the balloon is soft and it's not as pliable and it doesn't have that resistance. And so you will find that patients who are more and more have more and more fluid gains, the heart is less able to handle that persistent or consistent insult to the heart muscles. And that's one of the causes of the heart failure, because now you've lost your pump ability and you want those muscles to be able to squeeze down and pump. And so you don't want to go from an ejection fraction of 60% at year 1 and 2 to an ejection fraction, which means your heart's, when you think of 30%, then you're in trouble, because now we know that your heart isn't able to squeeze out the amount of volume that it needs to do so. When you get down to 25% for many programs, you may be taken off the list. So preserving your heart function is critical. Without a good heart and the good pumpability of the heart, remember your kidneys are downhill from your heart. So if your heart can't pump, think about that trickle of blood, then your kidneys are going to say, I'm not getting enough fluid. There must be something wrong, so I'm going to shut down because I'm not seeing enough to work hard. And so your kidneys will, the function of the kidneys will get less and less. So we've had patients with severe heart failure after transplant who, no matter biopsy the kidneys, there's nothing wrong with the kidney. You just don't have enough pumpability to move that fluid through to cause good function of your heart. So that is critical. Protect your heart, protect your kidney, make sure you're compliant. If you need to figure out how you can get from in-center dialysis to home dialysis, that is a way to go. If you can do peritoneal dialysis, that's a constant. Anything that gets you gets your fluid status off and normalize your volume on a regular basis, that is the way to go. Michael Gilchrist, it's been a while. Great having you here, and I'm sure Christina is nearby. Thank you so much, Mike. I appreciate seeing you. Again, my name is Dr. Velma Scantlebury. We've got about a minute left. If there are any other questions, I appreciate that. I appreciate all of you being here today and sharing this Facebook with us. It's, as I said, this is Kidney Month. If you know someone who needs to be educated about kidney disease, about knowing what to ask, be an advocate for them. When they're going to their doctors, oftentimes we don't know what's the right questions to ask, what our options are. It is so important to advocate for others, making sure they know they're going in the right direction, make sure they understand kidney disease is a silent disease. And because of that, so many people are not aware of the kidney function. You want to know your blood pressure, you want to know your cholesterol, you want to know what your blood sugar is and your hemoglobin A1C. Please add your kidney function to your list of things you want to ask your doctor. And you also want to check your urine for protein excretion, not just you. If you have many people in your family on dialysis, you may want to make sure that there's not a component of familial disease within your family. So thank you so much. I have bone disease, arthritis. My heart has less oxygen. There anything I can do? You want to talk to your cardiologist to see if there's anything he can advise for you to do to improve that. Thank you so much. God bless. Have a great day. And certainly follow Yolanda's recommendation. Join DPC. Get good information on the website. Get involved in advocacy and let your voice be heard. So thank you all so much. Have a great day.